Wellbeing Forum. Wellbeing Forum is an initiative by Jupiter Hospitals, Atladra, Vadodara. Now let's meet the founder of Wellbeing Forum, Dr. Tushar Patel, senior gynecologist and obstetrician at Jupiter Hospitals. What is Wellbeing Forum? Wellbeing Forum is a group of people who works to elevate human beings. What are our intentions in Wellbeing Forum? Our intention is purely to give back to society in any form of nature. What will be the outcomes in Wellbeing Forum? The outcomes are such as we support in the area of healthcare services, Mediclaim policy, economic growth, physical, mental, and spiritual well-being, and uplifting the lifestyle of humans. Our mission is to provide the standard comprehensive healthcare services to human beings at their affordability, to support all the citizens to self-reliable economically for their healthcare expenses through Mediclaim policies at their affordability, an uplifting lifestyle of a human being for their healthy lifestyle, the physical, mental, and spiritual well-being of all our associates with their sustained economic growth. What we do in Wellbeing Forum? We arrange a special guest lecture of approximately 45 minutes, which is called seminar, in which 5 minutes for the welcome speech, 30 minutes for speaker's lecture, and 10 minutes for answering your honorable questions. So now let's support an initiative by Jupiter Hospitals, which is Wellbeing Forum.
Good morning, public. I am Dr. Trupal Desai, laparoscopic and general surgeon, consultant at Jupiter Hospital, Atladra. Today, I am going to speak about hernia and its causes and its symptom signs and the complications and surgeries and non-pharmacological and pharmacological management in case of hernias. So, I will be speaking in Gujarati only for the general public. So, what is hernia? Hernia is in normal language it is સારણગાંઠ. સારણગાંઠ એટલે જ હર્નિયા. હવે સારણગાંઠ એ કોઈ ગાંઠ નથી, એ નોર્મલી પેટના સ્નાયુ વચ્ચે જગ્યા થઈ હોય એના લીધે બહાર આવતો આંતરડાનો અથવા ચરબીનો ભાગ છે, જેને આપણે સારણગાંઠ કહીએ છીએ. હવે ઇટ્સ ઓનલી અ મિથ ધેટ hernia is a ગાંઠ. hernia is a benign tissue, but it is not a benign tissue. It's just a protruding of a viscous or a part of viscous that comes out from the weakened wall of the abdominal cavity. Okay, that is called the hernia. The most important element in the development of hernia are congenital or muscle weakness and increased pressure in the intra-abdominal cavities. So, there are various types of hernia that are most commonly seen are the inguinal hernias, that is called groin hernias. That includes inguinal hernia and femoral hernia. The second most common is umbilical hernia, that is called that is in normal nomenclature it is નાભીના ભાગનું સારણગાંઠ. The third is epigastric hernia. Then other are lumbar hernias and diaphragmatic hernias, hiatal hernias, and intra-abdominal hernias. That are the types of hernia. So here are the most commonly seen pictures of the hernias. There are two different types in case of inguinal hernia. First is the direct hernia and the other thing is the indirect hernia. that both looks like normal for that looks like normal uh, viscous that comes from the groin region. There will be protruding of the skin or the muscle in the part of the groin, that is called inguinal hernias. The second most common hernia, it's femoral hernia, that is normally seen in the groin region, but it is just below the inguinal region. That is the femoral hernias. Now, the third hernia is umbilical hernia, that is seen in the near the umbilicus. So, an umbilical hernia occurs through a weak spot in the belly. This causes a bulge near the belly bottom or navel. It is congenital, appear in infancy, or acquired due to increased intra-abdominal pressure, common seen in obese patient or pregnant women, or in chronic alcoholic patients who has ascites since long duration. The other hernia, that is incisional hernia, that is due to the previous surgery that leads to the weakness of the muscle, and that causes the hernia, that is called incisional hernia. That is because of inadequate healing at the site of incision. That can be due to post-operative wound infection, inadequate nutrition, and obesity, and poor wound management. So now we will talk about the signs and symptoms that are that comes with that is what the patient comes with to the doctor. So uh, એ દરમિયાન પેશન્ટ એવી કમ્પ્લેન લઈને આવે છે કે અમને નાભીના ભાગમાં કે ગ્રોઇનના એરિયામાં સોજો આવી ગયો છે, ધેટ ઇઝ કોલ્ડ સારણગાંઠ. હવે બીજા એના સિમ્ટમ્સ શું હોય? ધારો કે પેશન્ટને ઘણા બધા પેશન્ટને કોમનલી કોન્સ્ટિપેશનની તકલીફ હોય, કોઈ ઘણા બધાને પેશાબમાં બહુ વાર જોર કરવું પડતું હોય, અથવા વારંવાર જવું પડતું હોય છે, અથવા પ્રોસ્ટેટની ગ્રંથિ પર સોજો આવી ગયો હોય, અથવા ઘણા દર્દીને બહુ લાંબા સમયથી ઉધરસ રહેતી હોય, બહુ લાંબા સમયથી કફિંગ રહેતું હોય, એ બધા કારણોની સાથે પેશન્ટ શરીરના કોઈ પણ ભાગમાં સોજો લઈને આવે છે. જે પેશન્ટ એવું કહેશે કે અમે લોકો ચાલતા હોય ત્યારે સોજો બહાર આવે છે, જ્યારે સૂઈ જઈએ છીએ ત્યારે સોજો અંદર જતો રહે છે. આ એક ટિપિકલ હર્નિયાની કમ્પ્લેન હોય છે. એટલે કોઈ બી માણસ માટે જ્યારે ચાલતો હોય ત્યારે પેટના ભાગમાં, નાભીના ભાગમાં કે ગ્રોઇન રિજનમાં ક્યાંય બી કોઈ સોજો બહાર આવે અને સૂઈ જાય અથવા રેસ્ટ કરે તો પાછો સોજો અંદર જતો રહે, એને નોર્મલ માણસ માટે એને નોર્મલી સારણગાંઠ કહેવાય છે. હવે એના કોમ્પ્લિકેશનના લીધે ઘણા બધા કોમ્પ્લિકેશન્સ જોવા મળે છે સારણગાંઠના લીધે. હવે એમાંના ઘણા સિમ્ટમ્સ છે કે પેશન્ટને વોમિટિંગ થાય, પેશન્ટને નોશિએટિંગ થાય, પેશન્ટને કોન્સ્ટિપેશન થાય, ઓબ્સ્ટિપેશન થાય. So there are many risk factors for hernias. The most common is heavy weightlifting, abnormal heavy weightlifting. The second most common is chronic cough due to tuberculosis, asthma. The third most common thing is constipation. The fourth most common thing is prostate enlargement. Or the other causes, other risk factors are pregnancies, obesities, damage from injury or previous surgery, or congenital defect. So hernias can be due to defect in muscular walls, that is because of congenital defects or obesity. Or the second thing, increased intra-abdominal pressure, that is because of pregnancy or trauma. So now we will speak about causes and etiology. Any condition that increases in pressure on abdominal cavity, combination of muscle weakness and strain, obesity, heavy weightlifting, persistent coughing or sneezing, pregnancy, straining during bowel movement or urination. As such, there is no non-surgical management in cases of hernia, but we can avoid the progression of hernia by doing regular exercise, quitting smoking, and avoid lifting heavy objects, or directly contact the nearby doctor for constipation or straining during urination and for coughing. There is the definitive management for the hernia is surgical management. So there are mainly two types of hernia surgery, that is called herniorrhaphy, and the other thing is hernioplasty. So in cases of herniorrhaphy, we just strengthen the weakened wall with the help of the natural body tissue. That is the oldest method of repair of hernia surgery. And the second most common thing is the new method, that is reinforcement of the weakened wall with the artificial mesh. In that case, we usually use the proline mesh for the reinforcement of the weakened wall, and we put the mesh over the muscle or the intra-abdominal organs. So, hernioplasty can be done by three methods. That is, one is the conventional method, that is open method. In that case, we usually put an incision over the hernial site. We reduce the hernial content. We reduce the hernial, abdominal viscous or the fat, and then we strengthen the wall of the abdomen, and then we put a mesh over the weakened wall, and then we close the skin. That is the conventional method for hernia surgery. The second thing is laparoscopic method. That is the that is latest, or that is recent method. In that case, we do the surgery with the help of laparoscope, or for normal public is દૂરબીનથી operation કરવાનું, that is called laparoscopic surgery for hernia. In that case, we usually put three incision in different areas of abdomen according to the hernia, which type of hernia is present with the patient. And in that case, we directly go in the abdominal cavity, or we do the surgery outside the abdominal cavity. That is called TEP and TAPP. TEP, that is totally extraperitoneal repair of hernia, and TAPP is transabdominal preperitoneal hernia surgery. In that both case, we usually put three small incision over the abdominal wall, and we repair the hernial site. And the evolving method, that is called robotic method. In that case, we use Da Vinci robot for the hernia repair surgery, that you can easily see on your slide. So there are many complications with the hernia. Like there can be strangulation, there can be obstruction, there can be incarceration, or there can be non-obstructing hernia. So if any patient has a small defect or any small bulging in the umbilical region or in the groin region, you should directly contact to the doctor, or be frankly to the surgeon for the hernia surgery. As such, there is no any medication or no any non pharmacological management is possible in cases of hernia. So there are many less complication after hernia surgery. That is mostly a post herniorrhaphy pain syndrome, that is called inguinodynia, wound infection, or hernia recurrence, or incisional hernia, that is commonly seen after the caesarean section surgery, or appendectomy surgery, or tubal ligation, or many other surgeries. In that case, there can be a minor injury to the nerve or to the muscle during the previous surgery, and that leads to the weakness of the wall, and that leads to the incisional hernia. So this is all about the hernia, and uh, that's all. Thank you.